If you're waking up every single morning with your tongue stuck to the roof of your mouth, your lips dry, your throat scratchy, and that desperate urge to reach for water before you can even say a word, I need you to stop treating this as something small. I'm Dr. Anna, and today I want to walk you through exactly what that pattern can mean. Because if you take Losartan, Amlodipine, Lisinopril, or Valsartan, and on top of that dry mouth you've also noticed ankle swelling, a nighttime cough, dizziness when you stand, unexplained fatigue, headaches, a pounding heartbeat, or that washed-out feeling you just can't put into words, your body may be trying to warn you before things get worse. Dry mouth is often the first thing people notice because it shows up quietly in the dark before the distractions of the day take over, but it is almost never the only clue. It's simply the clue that finally gets your attention. And once you understand what it can actually mean, you will never brush it off the same way again. Before we get into it, please subscribe to Senior Health for practical guidance, honest warnings, and simple explanations designed to protect you. Let me start with Diane, because her story begins exactly where so many of these stories do. Diane was 72, disciplined, careful, genuinely proud of how seriously she managed her blood pressure. She kept her pills on her nightstand, took them on schedule, followed every instruction, and never missed an appointment. But she started waking up around 3 in the morning with a mouth so dry it felt like she had cotton stuffed inside it. At first, she assumed the heater was running too high. Then she wondered if she was simply sleeping with her mouth open. Then came the second clue, a cough. Not a wet chest cold, not a fever cough, but a dry, nagging little tickle that caught her in the middle of the night. By the time she got out of bed, she also felt slightly lightheaded. Diane blamed the season. Her daughter blamed allergies. Her neighbor blamed dust in the house. But the real cause was sitting quietly in her pill organizer. She had started Lisinopril 6 weeks earlier. And here's where I need you to pay close attention, because Lisinopril belongs to a group of medications called ACE inhibitors. And one of the best-known side effects in that group is a stubborn, dry cough. Not everyone develops it, but when it shows up, it can creep in so gradually that you barely notice the pattern at first. You clear your throat a little more often. You keep water by the bed. You wake up irritated. You start breathing through your mouth more because your throat feels off. And once mouth breathing becomes part of your night, dry mouth becomes almost guaranteed. Yes, the mouth is dry, but the medication story is usually hiding right behind it. That cough matters more than people think. It's not just annoying, it changes the entire quality of your sleep. It makes you wake lightly instead of resting deeply. It can push you into sleeping with your mouth open. It can leave your throat raw by morning and your saliva thick and sticky. And then comes what I see over and over again. People don't connect the dots. They think they need more lozenges, more water, a better pillow, a humidifier, maybe a different toothpaste, never realizing the medication might be the spark that started the whole chain reaction. So the cough continues, the dry mouth gets worse, sleep deteriorates, daytime energy drops, and the person ends up living in this low-grade fog of irritation and fatigue without ever understanding why. Now here's the part your body may be warning you about even more urgently. Lisinopril doesn't only cause a cough in some people, it can also cause dizziness, especially when standing up quickly. That matters because dry mouth and dizziness together often point to a deeper issue with fluid balance, blood pressure dropping too low, or your body struggling to adjust to a medication change. If you wake up dry, stand up, and feel the room tilt for even a second, do not write that off as normal, and do not tell yourself, "I'm just getting older." That brief morning spin can be your body signaling that your blood pressure is dropping too far, that your dose may need a review, or that your hydration is off in a way worth addressing. And there's something else about Lisinopril that people almost never take seriously enough until it becomes an emergency: swelling of the lips, tongue, face, or throat. This is nothing like a little dry mouth or an annoying cough. This is a red flag reaction. If someone on Lisinopril suddenly notices swelling of the lips, a thick-feeling tongue, tightness in the throat, or difficulty breathing, that is not a wait until your next appointment symptom. That is urgent. The reason I'm mentioning this in the same breath as dry mouth is simple. Sometimes people describe the very earliest stage of throat swelling as "my mouth felt weird, my tongue felt thick, my throat felt dry, something just felt off." That vague sensation can be the earliest warning sign before things become obvious. So never dismiss a strange feeling in your mouth or throat if it comes with swelling or trouble breathing, especially while on an ACE inhibitor. Now let's shift to Amlodipine, because this medication tells a very different story, and it usually doesn't begin with a cough, it begins with the legs. Susan was 69 and had recently started amlodipine. At first she felt fine, a little flushed on some afternoons, maybe a mild headache, nothing alarming. Then she noticed her socks were leaving deeper marks around her ankles. Then her shoes started feeling tighter by evening. Then one night she looked down and realized both ankles looked puffier than they had a month earlier. Around the same time, she started waking up uncomfortably thirsty because she had begun limiting how much she drank in the evening. She assumed the swelling meant she was retaining too much fluid, so she cut back on water. Without realizing it, she made her dry mouth worse while the leg swelling kept progressing anyway. This is one of the most misunderstood side effects of amlodipine. People assume swelling means their body is overloaded with fluid in the usual sense, so they drink less, or they panic and assume their kidneys are failing, or they simply blame salt. But amlodipine can cause swelling in the ankles and lower legs because it changes how blood moves through the small blood vessels. The arteries relax strongly, but the veins carrying blood back don't relax to the same degree, so fluid can leak into the surrounding tissue. That's why the ankles and lower legs start looking puffy, and because it happens gradually, people normalize it. They say, "I was on my feet too long," or maybe that's just age. No. Sometimes it's the medication speaking very clearly. What makes this especially tricky is that people often end up solving the wrong problem. They see swelling, so they stop drinking enough water. Then they wake up with dry mouth. Then they feel tired. Then they stand up and feel a bit off. Now the whole picture looks confusing, but the body is actually telling one coherent story. Amlodipine may be contributing to the swelling, and the response to that swelling, drinking less, may be worsening the dryness and fatigue. Add in poor sleep, maybe some nighttime mouth breathing, maybe a warm bedroom, and suddenly you have a cluster of symptoms that feels mysterious when it really isn't. The longer people wait, the more they simply adapt to discomfort that should have prompted a medication review much sooner. That's how minor side effects quietly chip away at quality of life month after month. Amlodipine can also bring along other clues people dismiss too easily. Headaches that seem to appear out of nowhere, flushing where the face feels warm and red, a pounding heartbeat that suddenly makes you aware of your own pulse, dizziness, fatigue, and occasionally that heavy, sluggish feeling in the afternoon where everything in your body seems a little slower than usual. None of this automatically means the medication is wrong for you. Plenty of people do very well on amlodipine. But if it's helping your blood pressure while making the rest of your day miserable, that's not something to keep to yourself. It's a clinical fact your prescriber needs because sometimes the answer is a dose adjustment. Sometimes it's a timing change. Sometimes it's combination therapy. And sometimes it simply means a different medication is a better fit. Now let me tell you about Bernard, because his story brings us to Losartan. Bernard was 75 and felt like he was doing everything right. He took his Losartan every morning, walked daily, and because his doctor had told him to stay hydrated, he made a point of drinking more fluids. Then he caught a stomach bug. Nothing dramatic, just a couple of days of loose stools and a poor appetite. By the third morning, he woke up with an extremely dry mouth, stood up from bed, and nearly toppled into the dresser. He described it to me later as feeling like his body had no blood in it for a second. That sounds dramatic, but patients describe it that way because dizziness like that can feel genuinely frightening. In Bernard's case, the dry mouth was the clue that his body had already been losing too much fluid. This is one of the major issues with Losartan and also with Valsartan. These medications can be very helpful, but if someone becomes dehydrated from vomiting, diarrhea, hot weather, heavy sweating, poor intake, or another medication added to the mix, blood pressure can drop too far. Suddenly, that morning dry mouth isn't just a mouth problem, it's part of a dehydration story. Saliva production drops, the throat feels dry, the head feels light, the body feels weak, and the moment you stand up, you realize something is wrong. People miss this because they assume dehydration has to mean intense thirst during the middle of the day. Not always. Sometimes the earliest sign is simply waking up dry and feeling vaguely off before breakfast, before coffee, before the day even starts. And if you brush past it, the dizziness can be what finally forces you to pay attention. Losartan can also bring fatigue that people describe in subtle ways. They say they feel less sharp, mornings feel harder, nothing dramatic, just a strange heaviness in the body. That matters, because when dry mouth, fatigue, and dizziness travel together, the question is no longer whether you need a bigger water bottle. The question is whether the medication, the dose, your recent hydration, or your kidney function deserves a closer look. And I want to be very precise here. I'm not telling you Losartan is a bad medication. It helps a great many people and protects a great many hearts and kidneys. I'm telling you that when your body sends repeated signals, especially signals that cluster together, you shouldn't write them off as random annoyances. Symptoms are information, and older adults are too often taught to ignore their own information. There's another warning with Losartan that deserves more attention than it usually gets. If you faint, nearly faint, or repeatedly feel like you might black out when standing, that's not something to quietly monitor on your own for a few more weeks. And if you become sick with ongoing vomiting or diarrhea while taking it, that matters because a medication that normally helps can suddenly become too much for a dehydrated system. The same applies to heavy sweating in hot weather, extended time outdoors, or a stretch of poor eating and drinking. If your mouth is dry, your urine is darker than usual, your energy is low, and your balance feels uncertain, your body may be telling you the equation has changed. The pill may be the same, but the body receiving it isn't, and that gap is exactly where many preventable falls begin. Now let's talk about Valsartan, because people often lump Losartan and Valsartan into the same mental category and assume they feel identical in every body. They don't. Phyllis was 71 and started Valsartan after struggling with a different medication. At first, she was relieved because she didn't develop the cough she had been dreading. But after a while, she began waking up with dry mouth and a dull headache settled right behind her eyes. Some mornings she felt a little nauseated. Some days her muscles felt unusually tired. Nothing severe enough to send her to the hospital, but enough that she no longer felt like herself. And because there was no single dramatic symptom, she never brought the whole picture to her doctor at once. She mentioned the headache once, the dizziness another time, the dry mouth to her dentist, the fatigue to her daughter, and nobody ever heard the full story together. Valsartan can cause dizziness. It can come with headaches. Some people experience nausea, vomiting, or diarrhea. Some report muscle or joint discomfort, unusual weakness, or that strange drained feeling that makes even ordinary tasks feel heavier than they should. And once digestive upset enters the picture, dry mouth can intensify quickly because saliva production and fluid balance are both affected by dehydration. The person wakes up dry, drinks more, feels a little better, and assumes the problem is solved. But the pattern repeats. That repetition is what matters. A random dry mouth once in a while can come from all kinds of things. A repeated early morning dry mouth paired with dizziness, weakness, nausea, or poor balance while taking Valsartan is not something I want you shrugging off as coincidence, because sometimes the body repeats a warning precisely because the earlier attempts went unnoticed, before a fall or a faint forces the issue. There's also a laboratory side to this conversation that viewers need to understand. Some blood pressure medications, especially ACE inhibitors and ARBs, can affect kidney function and potassium levels. You can't see your potassium with your own eyes. You can't feel your creatinine rising in any obvious way, but your body can give hints: unusual weakness, strange fatigue, dizziness, just feeling off, changes after an illness, or swelling in places that don't quite make sense. That's why a symptom journal matters so much. If you wake up with dry mouth every single day for 2 weeks, write it down. If you also notice ankle swelling, write that down too. If a cough starts after a medication change, write down the date. If dizziness only hits when you stand up from bed, write that down as well. In the doctor's office, memory is unreliable, but patterns written on paper tell the truth. And here's a part almost nobody explains clearly enough. Dry mouth is not harmless just because it sounds harmless. Saliva protects your teeth, helps you chew, swallow, and speak, and keeps harmful bacteria and fungus under control. When your mouth stays dry, cavities become more likely, gum problems become more likely, and mouth sores, bad breath, burning sensations, trouble swallowing, and oral infections all become more likely too. So when someone says, "It's only dry mouth," I stop them right there. No, a persistently dry mouth isn't a cosmetic inconvenience. It's a biological change with real consequences, and in older adults especially, those consequences can snowball. Eating becomes harder. Sleep gets worse. Speech feels uncomfortable. Thirst wakes you up at night. Then fatigue builds. Then balance suffers. Then the whole body starts paying for a symptom that began in the mouth, but never really stayed confined to the mouth. I want to pause here and say something important. Not every case of dry mouth is caused by blood pressure medication. That would be far too simple, and it wouldn't be honest. Mouth breathing can cause it. Nasal congestion can cause it. Alcohol can cause it. Too much caffeine can cause it. Stress can cause it. Diabetes can cause it. Antihistamines and decongestants can cause it. Sleep apnea can cause it. a warm bedroom can make it worse. Aging on its own isn't considered a direct cause, but older adults are simply more likely to have the conditions and medications that create the problem. So the right way to think about this isn't, I woke up dry, therefore my blood pressure pill must be bad. The right question is, what else is happening alongside this dry mouth? And when did the pattern actually begin? This is why combinations of symptoms matter so much. Dry mouth plus a nagging nighttime cough points toward one kind of conversation, especially if Lisinopril is involved. Dry mouth plus swelling in the ankles or lower legs by evening points toward another, especially if Amlodipine is in the picture. Dry mouth plus unsteadiness on standing, especially after illness or heat, pushes me to think seriously about dehydration and whether Losartan or Valsartan needs a review in the context of your overall health, though Lisinopril can occasionally play a role here too. Dry mouth plus a strange feeling in the mouth or throat along with swelling of the lips, face or tongue is an emergency conversation, not a let's talk next week conversation. Dry mouth plus headaches, a pounding heartbeat, flushing, or afternoon fatigue makes the overall pattern even more important to notice. The body is rarely completely silent. It whispers first, and dry mouth is one of those whispers. The tragedy is that most people only learn to listen once the whisper becomes something louder, scarier, and harder to reverse. Let me tell you about Edward, because his case looked completely ordinary until we laid the symptoms out in order. Edward was 78. He had high blood pressure, mild kidney disease, and was on more than one medication. He started waking up with dry mouth. Then came a cough he mostly noticed at night. Then he became hesitant to drink much water in the evening because he was tired of getting up to use the bathroom. A month later, he was dizzy in the mornings, exhausted through the day, and irritable from weeks of poor sleep. He assumed he was just going through a rough patch. But when we laid out the timeline, the story became obvious. A medication change, then a nighttime cough, then mouth breathing, then dry mouth, then poor sleep, then morning dizziness. Each symptom fed directly into the next one. None of it was random. It was a chain reaction. And once we could see the chain, we knew exactly where to step in. That's what I want for you from this video. Not panic, clarity. Because panic makes people do dangerous things. They stop medications abruptly. They follow advice from strangers online. They cut tablets in half without guidance. They load up on salt to fight dizziness. They stop drinking water because their ankles are swollen. And every single one of those choices can make things worse. What I want is for you to recognize when a symptom belongs to a bigger pattern, and when that pattern deserves a careful call to whoever prescribed your medication. If dry mouth is new, persistent, and accompanied by other warning signs, it has already earned your attention. The body usually doesn't keep repeating the same message for no reason. It repeats it because earlier attempts were ignored. And if you listen early, you can often resolve the problem before it quietly steals months of comfort and confidence. So what should you actually do if this sounds like you? First, do not stop Losartan, Amlodipine, Lisinopril, or Valsartan on your own. I need to say that plainly. These medications can be doing important work, and stopping them suddenly without a plan can create serious problems. Second, start observing with precision. Tomorrow morning, before telling yourself a story about what a symptom means, just gather facts. Is your mouth dry every morning, or only sometimes? Is your throat dry too? Are you coughing at night? Do your ankles look different by evening? Are your socks leaving marks? Do you feel dizzy when you stand? Have you recently had vomiting, diarrhea, poor appetite, or fluid loss from hot weather? Did the symptoms begin shortly after a new prescription or a dose increase? That's not overthinking, that's good medicine, because symptoms without timing are vague, but symptoms with timing become evidence, and evidence changes treatment. Third, if you're on Amlodipine, look carefully at your feet and ankles at the end of the day and again the next morning. Compare both sides. Think about your shoes. Think about whether your rings feel tighter too. Ask yourself honestly whether you've been cutting back on fluids because you're worried about the swelling. Many people do this without even realizing it and end up trapped in a cycle where the swelling pushes them to drink less and the lower intake worsens the dry mouth, headaches, fatigue, and dizziness. If that's happening to you, don't just keep improvising. Bring it up clearly. Tell your doctor exactly what you're seeing. My ankles swell by evening. I wake up dry. I feel tired. That sentence is far more useful than people realize. It gives your clinician a pattern to work with, and often a better solution is closer than you'd expect once the full picture is visible. Fourth, If you're on Lisinopril and a cough is part of the picture, pay attention to its character. Is it dry? Is it worse at night? Does it make you reach for water? Does it wake you up? Do you find yourself constantly clearing your throat? That kind of cough shouldn't be permanently dismissed as just one of those things. There may be good reason to consider a medication review, especially if the cough is damaging your sleep and leading to persistent morning dry mouth. And again, don't self-diagnose your way into stopping the medication. Just report the facts clearly. Since starting this medication, I have a dry nighttime cough and I wake up with dry mouth. That's a medically meaningful statement. It might lead to nothing more than monitoring, or it might lead to a change that genuinely improves your life. But if it's never said out loud, the suffering stays invisible, and invisible suffering is the kind most likely to be ignored. Fifth, if you're on Losartan or Valsartan and you develop dry mouth together with dizziness, nausea, vomiting, diarrhea, weakness, or darker urine, take that combination seriously, especially if you've been sweating heavily, eating poorly, or recovering from illness. Many people assume they should just push through a few rough days, but blood pressure medication combined with dehydration can become dangerous quickly. If you feel faint, lie down, rise slowly, rehydrate if you're able to, and contact your healthcare team promptly, especially if symptoms continue. This matters even more if you're older, smaller in body size, already prone to falls, or taking other medications that lower blood pressure. A morning fall often looks sudden from the outside, but inside the body, it usually built up over time. Dry mouth, imbalance, fluid loss, poor intake, dizziness. The body gave its warnings, but nobody recognized them as a sequence until gravity did. Now I want to give you the symptom map I wish more patients had pinned to their refrigerator. If you wake up with dry mouth and also have a persistent dry cough, especially at night, think Lisinopril conversation. If you wake up with dry mouth and by evening your ankles or lower legs are swelling, think Amlodipine conversation. If you wake up with dry mouth and standing up makes you feel unsteady, especially after an illness or heat, think Losartan or Valsartan conversation, though Lisinopril can occasionally contribute too. If your mouth or throat feels strange and you notice swelling of the lips, face, or tongue, think emergency, not next appointment. And if headaches, a pounding heartbeat, flushing, or afternoon fatigue are tagging along, the overall pattern matters even more. This map isn't a diagnosis, it's a way of listening, because symptoms make far more sense when grouped together, and once grouped, they become much harder to dismiss. There's one more reason dry mouth deserves real respect, and it has to do with sleep. Many viewers who wake up dry are also waking up tired, and that's not a coincidence. A nighttime cough from Lisinopril can fragment your sleep. Mouth breathing can dry out your throat and make sleep less restorative. Getting up repeatedly for water can keep you stuck in a cycle of shallow rest. Dizziness or an unsteady feeling can increase anxiety about falling, which then makes sleep even more fragile. So when people say, "It's only my mouth," they're missing the system-wide cost. Poor sleep worsens blood pressure control, balance, mood, memory, appetite, pain tolerance, and daytime energy. The body is one connected conversation, not a collection of unrelated parts. The mouth, the throat, the circulation, the kidneys, the brain, and the sleep cycle are all speaking to each other. Dry mouth may simply be where that conversation first becomes audible, but it almost never ends there. If this video helped you connect symptoms you'd been treating as completely unrelated, share it with someone who takes blood pressure medication and keeps insisting they're fine, even though they clearly aren't. And if that person is you, let today be the day you stop minimizing what your body has been trying to tell you. You're not being dramatic for noticing patterns, you're being wise. Your mouth, your throat, your legs, your balance, your sleep, your energy, they're all sending you information. Listen earlier. Speak up sooner. Never change your medication on your own, but never stay silent about side effects either. From Senior Health, your health isn't just about lowering a number, it's about living safely and comfortably inside the body you have. Take care of yourself and pay attention to what keeps repeating.